October 15th of 2020, according to the CDC, 216,000 Americans have lost their lives to COVID-19, or better known as the coronavirus. Among these dead Americans, the greatest increase of percentage dead are adults between the ages of 24 and 44 years old. I have done lots of research on this topic of being for a nationwide mask mandate, and I am citing facts and information from websites that are run by the experts on this topic. How many of us know we could be spreading COVID-19 or not? How do you know you're carrying COVID-19? So what makes you think a mask is not of importance and not to be worn? Let us be honest, you have no clue what you could be carrying or spreading, and the majority of people are not to be tested every day. COVID-19 symptoms may show up 2 to 14 days after your infection, according to the CDC, which causes many people to feel fine and go about their day. This is one of the large problems, according to the CDC, within this pandemic. Now, I'm going to persuade the class on why to support a nationwide mask mandate. In this speech, I will begin to talk about how a national mask mandate will slow the spread and suppress the transmission of COVID-19. Then I will explain why wearing a mask is important and saves lives. Next, I will go into speaking on what a mask mandate can do for our economy and the opening of our country. Finally, I will state some of the common counter-arguments that go along with a nationwide mask mandate. A nationwide mask mandate slows the spread and suppresses the transmission. Mandating masks nationwide has the ability to dramatically decrease the transmission rate of COVID-19. According to Hartford Healthcare, researchers found a reduction in COVID-19 transmission by examining daily changes in COVID-19 growth rates within 15 states and the District of Columbia that issued mandates. The statistics found are in 6 to 10 days, 1.1% total of COVID-19 cases are averted with all these states within 21 days of all these guidelines. According to Hartford Healthcare, it also stated, combined with other guidelines such as social distancing and such, the overall rate of averted COVID-19 cases reaches 19% when a mask is mandated. According to the World Health Organization, when two individuals are both wearing face coverings and at least are 6 feet apart from each other, the chances of contracting COVID-19 are extremely low. A study backed by the World Health Organization showed with the face masks, the chance of infection or transmission was 3% with a face mask compared to 17% without a mask within facilities like a hospital or such. This just goes to show how these effects can translate to the public if a nationwide mask mandate was put in place. Since the outbreak of COVID-19 is ravaging through America, a nationwide mask mandate needs to be put in place to slow the spread exponentially. People like to argue that a mask mandate is an attack on their liberty and freedom. People also tend to say the government should not be telling them what to do. Just because an individual does not want to wear a mask due to them exercising their freedom does not mean someone else should pay for their choice and possibly contract COVID-19, which could lead to death or lifelong complications. As Newsweek letter fact checkers point out, the Constitution gives states and the government the ability to protect the welfare, safety, and health of the public. And in the face of a global pandemic, courts have found that mask mandates are a justified measure. Since the mandates are also not to prohibit a person from gathering or sharing their opinions, except if the person refuses to wear a mask, is not the freedom or a liberty issue. To continue, a mask does indeed save lives of countless fellow Americans. The wearing of a face mask or face covering saves the lives of thousands of our fellow Americans. Face masks not only reduce the spread of COVID-19, but have the potential to save somebody's life. Somebody who has asthma, diabetes, or any other health condition that is a risk. I would also like to point out even the perfect healthy person who contracts COVID-19 can die or damage their body for lifelong issues. The CDC goes into great depth on the utilization of face masks. The CDC has pointed out why face masks protect against and are proven to significantly work or be effective. According to the CDC, multi-layered cloth face masks block the release of exhaled respiratory particles into the environment, along with the microorganisms these particles carry. Cloth masks not only effectively block most large droplets, but they can also block the exhalation of fine or even smaller particles. Also, they're referred to aerosis, smaller than 10 microns, which increase in the number or volume of speech. The CDC also states Studies demonstrate that cloth mask materials can also reduce wearers' exposure to infectious droplets through filtration, including filtration of fine droplets and particles less than 10 microns. Studies by the CDC also show upwards of 80% blockage has been achieved in various human experiments that have measured the blocking of all respiratory droplets within the use of cloth face masks. These factors are enough to prove that the use of face coverings is more than well effective, and yet goes to prove my point that why masks should be mandated nationwide. Many people refuse the idea of mask or face masks because it is said that COVID-19 is not much more of a common flu. OSF Healthcare's Dr. Martin from Western Illinois College put out a great article speaking on the differences of the flu and COVID-19. According to Dr. Martin, the novel coronavirus creates a much more intense inflammatory response in the body than the flu. In part, doctors and researchers believe the immune system goes into overdrive, harming many of the cells that were not originally affected. Dr. Martin also goes to speak the virus overruns the system, causing blood clotting, causing the effects on the nicotine system, which then causes a flurry of inflammation in the small tissues in the blood vessels and scarring of the human body, which can also affect and lead to long-lasting changes affecting your lungs and other things. Just because you know somebody who had no symptoms like myself does not mean that the illness cannot be deadly to others. It is far from the flu in aspects of what actually goes on within the human body. Next, the use of mandated face masks can have more effects in saving lives and suppressing transmission. With the effects of a mandated mask policy nationally, the country can fully open sooner and our economy can fully open quicker. One thing I'd like to point out is how our economy has not been fully open for months now. We all know this because we're living in it. The reason the economy cannot be fully open is because the spread is not being slowed down in many parts of the country, causing businesses and such to really just close their doors and end up gone for good. If you want the economy to open up and be able to go back to a normal life, the spread of the virus has to be slowed first. Businesses are going out of business, shutting down due to the lack of opening allowed in their various states, which is just not overall good for our economy. According to the Federal Reserve Bank of Dallas President Robert Kaplan said, the U.S. growth would be faster if all Americans wore masks. Goldman Sachs Group Incorporated estimates a national mask mandate could prevent the U.S. from losing almost 5% of its gross domestic product. This clearly shows the effect a mask mandate can have on our economy as a whole, and this is coming from a figure of power. Finally, a nationwide mask mandate could open the economy sooner and allow us to return to our normal lives much sooner. I think one thing everyone can agree on this from the time is nobody likes COVID-19 and the effects of it. People think the economy should already be fully open since the virus is not as deadly as portrayed. Many think the economy should be fully open right now with no restrictions for businesses or such due to the belief that COVID-19 is not much more than a flu. According to New York Times writer David Lichthart, he states that the vast majority of the American population, about 90%, has not yet been exposed to the virus. There is tremendous potential for outbreaks worse than we have experienced by far. This goes to show you the detrimental effects of opening early can have on the American society as a whole. To summarize, a mask mandate would greatly reduce the overall transmission and would stop the spread of COVID-19 in America. The importance of wearing a mask cannot be fully stressed enough due to its role in saving lives of countless Americans. With a mask mandate in place, our country's economy could be open and booming sooner than later, while having countless lives saved. A mask mandate is more than making people stick to a piece of cloth or fabric on their face. It is about ensuring the safety of millions of Americans while trying to get our country back on its feet. A mandate will save lives, stop the spread, and we can get our normal lives back.